Psychogenic erectile dysfunction. This is the form of erectile dysfunction that begins in the mind. It doesn't stem from a physical injury or a problem with blood vessels. Instead, it arises from the brain's inability to send or process the signals that trigger an erection. To understand how this happens, you have to look at the brain's chemistry during arousal. Sexual arousal begins in the hypothalamus, where dopamine increases desire and motivation. Signals then travel through the spinal cord to parasympathetic nerves in the penis, which release nitric oxide that relaxes blood vessels and allows the erectile tissue to fill with blood. But when a man experiences anxiety or stress, the brain releases norepinephrine and adrenaline. These are stress hormones designed for survival, not sex. They activate the sympathetic nervous system, the same system that makes your heart race when you are scared. This overrides the relaxation signals. The blood vessels in the penis stay tight and constricted. The erection simply cannot start, no matter how strong the mental desire is. Performance anxiety is the classic example, but the triggers go deeper. Relationship conflicts, work stress, financial pressure, or even a past history of sexual trauma can keep the brain in this heightened state. Depression also plays a role because it lowers dopamine levels naturally, killing desire at the source. The good news is that because the body is physically capable, psychogenic ED often responds well to non-medical approaches. Therapy, particularly cognitive behavioral therapy or couples counseling, can address the underlying triggers. Sensate focus exercises, where a couple gradually explores touch without the pressure of intercourse, can retrain the brain to associate intimacy with relaxation instead of performance. In some cases, doctors may prescribe short-term use of PDE5 inhibitors like sildenafil to create successful experiences, which builds confidence and breaks the anxiety cycle. Organic erectile dysfunction. This category has a clear physical cause. If psychogenic ED is a software problem, organic ED is a hardware problem. The most common cause is the cardiovascular system. An erection is a hydraulic event. It requires a surge of blood to enter the penis and become trapped. But this process depends entirely on the health of the blood vessels and the smooth muscle tissue. Inside the arteries, there is a single layer of cells called the endothelium. This layer is critically important because it produces nitric oxide. Nitric oxide is the signaling molecule that tells the smooth muscle in the penis to relax. Then the arteries expand and blood rushes in. In men with high blood pressure, high cholesterol, or diabetes, this endothelial layer becomes damaged over time. It is like having a scratch on a non-stick pan. The surface is rough and it cannot release nitric oxide effectively. The arteries become stiff and narrow from atherosclerosis, which is the buildup of fatty plaques. Unlike the sudden onset often seen with psychogenic ED, organic ED usually develops gradually over years. The erections become less firm. Morning erections, which are a good marker of vascular health, may fade or disappear entirely. The risk factors here are well established. Smoking damages the endothelium directly. Sedentary lifestyle reduces blood flow. Obesity increases inflammation throughout the body. Poor diet high in processed foods accelerates plaque buildup. Regular aerobic exercise improves blood flow and helps the endothelium regenerate. Weight loss reduces inflammation. A Mediterranean-style diet rich in vegetables, healthy fats, and lean protein can slow or even reverse some arterial damage. Statins may be prescribed to manage cholesterol. Blood pressure medications need to be carefully selected because some, like beta blockers, can worsen ED. Neurogenic erectile dysfunction. This type points to a disruption in the nerve pathways that control the erection, and the message never reaches the penis. There are actually two different pathways involved. Psychogenic erections, the ones that come from seeing or thinking something arousing. Reflex erections, the ones that come from direct physical stimulation, are handled by a spinal reflex arc that can function even without input from the brain. Neurogenic ED is common in men with multiple sclerosis, where the immune system attacks the protective covering of nerves. It also occurs in Parkinson's disease and after spinal cord injuries from accidents. Diabetes is a major cause as well because chronically high blood sugar damages small nerves throughout the body. Perhaps the most well-known cause is surgical trauma, especially surgeries to remove the prostate for cancer. After prostate surgery, doctors often prescribe daily low-dose PDE5 inhibitors to keep blood flowing to the penis. Vacuum devices and injections can create erections directly by bypassing the nerve signals altogether. For permanent nerve damage, penile implants remain the most reliable long-term solution. Hormonal erectile dysfunction. Here, the issue is chemical rather than structural. Testosterone is the primary hormone governing male sexual function. It doesn't directly create an erection the way blood flow does. Instead, it fuels the libido. It also supports the brain's response to sexual stimuli and promotes nitric oxide production. Low testosterone means a man simply doesn't have the desire to initiate. Without that spark, the physical response may not follow. But testosterone is not the only player. The brain also controls the pituitary gland that releases hormones governing the testes. Sometimes the pituitary gland produces too much prolactin, which is associated with milk production in women, but in men, high levels can effectively shut down the entire sexual system. It suppresses dopamine and testosterone simultaneously. This can be caused by benign pituitary tumors called prolactinomas or by certain medications like antipsychotics. Thyroid disorders also play a role. It can disrupt the balance of sex hormone-binding globulin, or SHBG. SHBG is a protein that carries testosterone in the bloodstream. When SHBG is high, it binds too much testosterone, making it unavailable to the tissues. The blood test might show normal total testosterone, but the free testosterone, the part that actually works, is low. Body composition matters too. Fat tissue, especially around the belly, contains an enzyme called aromatase. This enzyme converts testosterone into estrogen. More body fat means lower testosterone and more estrogen levels. Managing hormonal ED starts with blood tests. If levels are clinically low, doctors might explore testosterone replacement therapy, but this is not a simple fix. Testosterone therapy can affect fertility and may have cardiovascular risks, so it requires monitoring. If prolactin is high, medications like cabergoline can shrink pituitary tumors and lower prolactin. Lifestyle factors also matter, like strength training, which can boost testosterone naturally. Adequate sleep is critical. Vitamin D and zinc levels also influence production. Medication-induced erectile dysfunction. Sometimes the dysfunction is a side effect of a drug. A significant number of prescription drugs list ED as a potential adverse effect. The most notorious are antidepressants, specifically selective serotonin reuptake inhibitors, or SSRIs. These medications increase serotonin levels in the brain, which helps with mood, but serotonin also inhibits sexual function. Blood pressure medications are another major category. Beta blockers such as propranolol and metoprolol work by blocking the effects of adrenaline, thereby lowering blood pressure and heart rate. They can also reduce the force of blood flow and blunt the physical sensations of arousal. Diuretics or water pills reduce blood volume to lower pressure, but less blood volume means less blood available for an erection. Even some common medications have effects. Finasteride and dutasteride, used for hair loss and enlarged prostate, work by blocking the conversion of testosterone to DHT. This can lead to sexual side effects in some men. Chemotherapy drugs can damage nerves and blood vessels directly. If a man suspects his medication is causing ED, the most important step is to talk to the prescribing doctor. Stopping a medication like an antidepressant or blood pressure drug abruptly can be dangerous. The doctor may be able to adjust the dose, switch to a different class of medication with fewer sexual side effects, or add another drug to counteract the effects. Mixed erectile dysfunction. In reality, most cases of erectile dysfunction are not purely one type or another. They are a blend, and this is where things get complicated. A man might have a mild vascular issue from aging arteries, which causes slightly less firm erections. Maybe the erection is 80% rather than 100%. This physical change is minor. It might not even be noticeable on its own, but then he notices it. He starts thinking about it. The next time he is with a partner, he is watching himself, monitoring his performance, waiting to see if it happens again. This monitoring creates anxiety. The anxiety triggers adrenaline. The adrenaline constricts blood vessels. The 80% erection becomes a 50% erection, or nothing at all. The physical issue provided the spark, and the mind poured gasoline on it. This is the feedback loop of mixed ED. The body and the mind feed each other. Untangling which part is the root cause and which part is the reaction is the challenge for doctors. The approach to mixed ED requires looking at the whole picture. A thorough workup includes blood tests for hormones and metabolic health, a review of medications and lifestyle, and sometimes a psychological screening for anxiety or depression. Treatment often combines approaches. The goal is to break the cycle at multiple points. Treat the body to give the mind less to worry about. Treat the mind to stop it from sabotaging the body. When both are addressed together, the outcomes are better than treating either one alone. Never feel shame when you need help with your erections. It might actually save your mental health and love life.